Good morning. Good morning, everyone. Thank you so much for coming. We hope you've enjoyed the conference thus far. I attended yesterday as well. How many of you attended yesterday as well? Okay. Wow. Okay. So some of you have attended both days. That is wonderful. And they've had really great resources for parishes and for parishioners. So I just wanted to take a moment to introduce myself, and then I'll turn it over to my colleague, Tammy Mermelstein. But I am Carmen Castro. I am with the Harris County Area Agency on Aging, as well as with the Harris County Aging and Disability Resource Center. I've been working in the field of aging now for about almost 20 years now, and I have been with the City of Houston Health Department, the Harris County Area Agency on Aging, for about 3 years now. So I'll be speaking to you about the Harris County ADRC, and I'll turn it over to Tammy so that she can introduce herself, and then we'll get started with it.
Hi, everybody. I'm Tammy Mermelstein. I am the Executive Director at the Collaboratory for Aging Resources and Education, or CARE. Probably one of the coolest little agencies you've never heard of unless you've already visited my table yesterday or today. CARE is basically designed to support older adults, caregivers, and the professionals who serve them. And our goal is to be the place that people can go to for information when they don't know where to start or they don't know who to call. And I'll go a little bit more into that in a few minutes.
Okay, wonderful. Well, thank you, Tammy. So, as I stated, my name is Carmen Castro, and I am with the Harris County Aging and Disability Resource Center. We provide services to people who are of any age with any disability. We primarily provide services to people who are 59 years of age and younger, who have a disability, as well as their caregiver. And basically, our mission is basically to assist any person with any disability and their caregivers. And our objective is to make service delivery navigation less fragmented and easier to navigate for people with a disability as well as for their caregivers. So we are one arm, in a sense, of the Harris County Area Agency on Aging. How many of you have heard of the Harris County Area Agency on Aging or of the ADRC? Okay, perfect. So a couple of you have heard of us. Wonderful. And so they say that we are like the best kept secret, in Harris County, but we receive federal funding to provide services for people here in Harris County. So your tax dollars pay our salary. So we are here to assist. The ADRC is basically, we have a system called the No Wrong Door system, which basically, if people call us, we have an 855 number, 855-YES-ADRC, and you can call us, and it'll ring to a statewide number, and then based on your zip code, it will be routed to us. So we provide services within Harris County, but if you live in places like Montgomery County, Fort Bend, or any of the surrounding counties, because, the Archdiocese serves not only Harris County, but other counties as well. There's another agency, the Houston Galveston Area Council, that provides services as well. Same services that we do pretty much. And so what we have is a No Wrong Door system. So people can call us, call the 855-YES-ADRC number, and we'll help them with their options counseling. If they need assistance with applying for public assistance, whether it's food stamps, SNAP, we can assist with that. Once again, we not only serve people who are adults with disabilities, but we also serve even children, the caregivers. We also serve the caregivers of people with a disability. And some of our programs really include, we are a staff of 7, so we are a small team, but we are small but mighty, as they call us. And basically, we have people who man the phone Monday through Friday, 8 to 5. But we also have counselors who provide options counseling to individuals, and we also provide assistance with respite. So if someone needs respite services for their loved ones, we can assist with that as well.
Would you explain what respite is for people who may not know?
Okay, sure. Respite is basically, it's a break. Respite provides you with a break. It's the Texas Respite Program, and it provides you with a break as a caregiver. If you care for your loved one, then our program can provide you with a break for caring for your loved one. And it can be either in-home respite or out-of-home respite. So, for example, some people, have you heard of like Amazing Place for seniors? It's a place that provides, basically day activities for a person with Alzheimer's. And, so it helps with socialization for the client, but their caregiver, it also gives them a break. So respite is basically a little bit of a break. And basically we have a vouchers, and it's for 100 hours of respite, so you can break it down however you wish. We also provide respite for parents or grandparents. If you're a grandparent raising your grandchild and your grandchild might have a disability, through Easter Seals there are camps that provide a week-long camp for children with a disability, and so it gives their caregiver a bit of a break. So that's one of the services that we have. And then we also have a roadie transportation program. So the transportation program is within Harris County, and to qualify, there are only three things you need. You need to, one, live in Harris County, travel within Harris County, and be 59 years of age or younger with a documented disability. And that the documentation can come either from one's doctor or from your SSI eligibility letter. Mm-hmm.
You said 59 or younger?
Mm-hmm. Mm-hmm. There's also our counterpart, the AAA, also has services, transportation services, and they have two different transportation services with which they partner with other agencies. One is for transportation, medical transportation to appointments, etc. But then there's also transportation services for non-medical, and so we can take you pretty much anywhere. Except, like if you want to go to the club or something. But, like if you want to go visit a neighbor or visit family or go to church, yeah, because we were realizing that we were getting lots of calls from people who needed transportation services, but not necessarily just to see the doctor, but to go grocery shopping or to help with quality of life, visit family, run errands. So the AAA side has those services as well.
And you can access them by calling 832
393.
Yep. 4301. Mm-hmm. And that's the call center for services for 16 over in Harris County. And you can say, I'm looking for information on how to qualify for the transportation program, and they'll get you from there.
Yes. And you had a question?
What about military disabilities?
Oh, that's a good thing. I'm glad you mentioned that because, yes, the ADRC.
You want to do it?
Okay, sure. 832-393-4301.
And that's for 60 plus.
60 plus, yes.
This is transportation?
For a lot of services. A lot of different things.
Yes. It's for a lot. Like the AAA has transportation, respite, even benefits counseling for people on Medicare. So the AAA, that's the front door. The 832-393-4301 number, that's the front door for AAA services. You'd mentioned military. Yes, we do have a program for veterans. So basically, the AAA side of the house, which is for seniors, they have what's called a veteran-directed care program, and the veteran-directed care program is basically a program that allows veterans to direct their care. They even get a budget to hire a caregiver to help meet their needs. And it used to be that their disability did not need to be service connected, but now there's been a big demand, and so in order to make sure that we meet the veterans whose disability came about as part of their service, the Veterans Directed Care Program is for people who have an injury that is service connected. But once again, that's for the AAA side, the Area Agency on Aging side, but our program for veterans who are essentially 59 years and younger, yeah.
That's exactly what I'm looking for.
Okay, yes, we can definitely help because we have a veteran specialist who is a veteran. He's a veteran of the Navy, and he helps connect veterans to services, whether it's SNAP, public assistance, or connecting them with the VA so that they can get their VA benefits. Some veterans don't know how to access benefits through the VA, so our veteran specialist can help with that. Yeah.
Your phone number?
It's the 855-YES-ADRC, and I always remember 855-YES-ADRC.
855-937.
855-937-2372.
And one of the things is with the no wrong door policy is if you call one and you really need services from the other, they'll get you connected.
Yes.
So that's part of the idea of these two agencies working together.
Mm-hmm. What is it for? It's basically for people who are 59 years of age and younger with a disability, or the caregiver of people who are 59 years of age and younger with a disability. For help. Yeah, it's basically for options counseling to connect them with services, because the services for people, it was found that people who are younger with a disability, services have been really fragmented, right? And so the ADRC helps connect them to services. You'd asked for about veterans. So for veterans, one of the biggest challenges, one of the biggest needs that we've seen, at least here in Harris County, is housing. And so our veteran specialist works very closely with our housing navigator and local contact agency to help connect veterans with housing services. Yeah, and they advocate for policy changes as well to help veterans access services. And for people who are 59 years of age and younger, but who have Medicare because of a disability, who they may need help with their premiums. So we have a program, we have counselors who can help them apply for whether it's the Medicare Savings Program or whether it's the low-income subsidy to help with the Medicare premiums, both A, B, and D. And some of the other programs, so we mentioned benefits counseling, respite options counseling, veteran services, and long-term care planning. So basically, we assist people with long-term services and supports, those who live in the community. Okay, for assistance with institutional long-term services and supports, we will connect you to the long-term care ombudsman for that. But that's it in a nutshell. We at the ADRC help connect people under the age of 60 with a disability to services. We want to make their care as seamless as possible, their access to care as seamless as possible, and that's what we do. So I'll turn it over to Tammy now so she can talk about her services.
Thanks, Carmen. Carmen and I go way back in different roles, so it's actually really exciting to be up here, I think, for the first time together. So what I wanted to do is to kind of talk with you all for a second. So how many of you chose this session because you wanted to learn something for yourself? Okay. How many of you chose this session because you're a caregiver to somebody and you want to learn something to help somebody that you care about? Okay. Some of the same people. How many of you are here to take information back to your parish or to groups or anything like that? Okay. All right. I've been in aging now for about a decade. Things that I have learned along the way, and I have also served as a caregiver to an older adult who passed away a few months ago. So I understand, at least some firsthand challenges of being a caregiver. I do not yet know firsthand some of the challenges related to aging. I'll get there, hopefully. But one of the things is that when you have people who've never had to ask for help before, who don't want to be asking for help, frankly, right? Who are afraid that if they ask for help that somebody might take it as a sign that they can't do things on their own anymore. That's kind of where CARE started from, this idea of being a place where somebody can go for good information, whether that information is about for-profits or nonprofits or government agencies, to be a place that people can call when they're like, I don't even know if this exists, I don't even know where to start. And so I can be one of those places. Now, I do a lot of referrals to the Area Agency on Aging and the ADRC because when it comes to government-funded services, they are one of the top places to go. But sometimes there are things out there that are not covered by their services, and so I make it my job to know as much as possible about the services that are of benefit to older adults and to caregivers and to the people that, professionals that serve them. And so that's kind of what CARE is in a nutshell. I do not charge for my services. Nobody pays me money to recommend their services. Like if I give any recommendation, it's usually because I've known somebody firsthand from that agency. Here's who that person is, because I try to build those relationships. I treat everybody who calls me as if it was somebody calling from my own family. If I would not send my family to that person, I'm not sending anybody else to that person either. And so that is kind of what I do, and one of the things that I wanted to do kind of in my time is open it up to you all for some of the things that you're seeing of, hey, does this even exist? And let's have a conversation. Does anyone want to start? Like I'm looking for, or my friend is looking for.
Is there an income qualification for any of these services?
So, talk to me? Absolutely not. For most of the services through the AAA, I would say there's not an income qualification.
No.
There are services in the community that do have an income qualification, depending on what it is that you're looking for. So, people call me, unfortunately, I've had a lot of calls over the last few months from seniors facing eviction because rent costs have gone through the roof. Income has not gone through the roof for the same people. And so we're seeing more and more seniors facing challenges with housing. I get a lot of calls for transportation. People saying, you know what, I can't drive anymore for whatever reason, and I still, my life isn't over. What can I do to get around? I've had calls from people who are caregivers who will say things like, actually one of the ones that stand out for me, it was right after Harvey. And I was doing a lot of work. I live in one of the areas that flooded really badly during Harvey. And it was actually somebody from my neighborhood. And this gentleman contacts me and he goes, I want to move my dad to a nursing home. And I said, okay, why? He goes, well, because he's 93. It's like, well, what does he want? I don't know. I haven't asked him, but I'm just worried that something's going to happen to him. And so I sat down with him and his son, and we had a conversation. And for the first time, the father said to the son, I want to be in the home where I raised you. I want to be in the home where I lived with your mother. I don't want to be moving someplace else. And it came down to the fact that for the son, he was operating from a place of fear. It wasn't what his dad wanted at all. So sometimes I get called in for things like that, or, people trying to figure out, what do I do? My mom is showing signs of dementia and I can't care for her anymore. Am I a bad person for, no, you're not. So some of it's just that conversation and that reassurance. Some of it's that service connection. It just depends on what happens when, whoever's on the other side of the phone. So I've helped people find food. I've helped people find housing. I've helped, with housing assistance, though right now, unfortunately, there isn't much in the terms of housing assistance. Sometimes it's just having a person to talk to. I'm a startup, even though I've been in this field now for a decade. I'm starting up my own initiative. So I have a little bit more time than some of these other places do to really talk to somebody. One of the other things I've learned over the years is that frequently whatever somebody thinks they're calling about is not actually what they need. Or if they need it, it's not the cause. It's not the root cause where if you solve that problem, you've solved every other problem. And so by talking with somebody, sometimes we can get to that bigger issue. So, for example, if I have someone who's calling because, they're struggling with food. Well, let's talk about why you're struggling with food. Well, because I just got this $800 water bill. Okay, so we can talk about the food, but let's also talk about the water bill and how to keep that from becoming a bigger issue. So it really is a hodgepodge. One of the other things that I do under CARE is I go out and do community presentations on different topics to different groups. One of my newest presentations, it's kind of a fun one. I theme it off of Ghostbusters. It's Who You Gonna Call? So I talk about what the major players are in aging in this area so that if you've never heard of the Area Agency on Aging, right, and you hear it's like, oh, call this place, like, well, who are these people, right? And so it's an opportunity to have that conversation of here are the trusted people. Like, if you have an issue, here's where you start, and if you don't know where to start with me. And that's the biggest part of what I do is I talk to people, I try to solve problems. I always tell people I'm not a miracle worker. Sometimes whatever somebody needs really doesn't exist. We do have a lot of gaps in our community, unfortunately. Yes, ma'am.
What is your phone?
Sure, and I have flyers too to make sure, so you guys can take a flyer and my card. So my number is 346-704-4233. So as a reminder, my name is Tammy, and that number, at least so for now, until I get bigger, goes to me directly. I do tell people it is a Google Voice number, and I tell you that because if you've never called a Google Voice number, it can be a little off-putting at first, because as soon as you call, you get this nice little friendly voice that says, please state your name. You're like, why? But you state your name, and then it rings my phone, and if I'm able to answer it, I will, and if not, then it'll send me the voicemail message. Like I said, I'm a small shop. It's myself and currently 2 interns that we deal. We deal with all of Harris County. If you are outside of Harris County, I would still encourage you to call. I don't have as many connections outside of Harris County, but at least I can say, all right, here's what we need to be looking for. And then I call in some of my partner agencies outside of the county to address those things as well. So we're here for helping. Yes, ma'am.
I see that Dr. Castro is a employee of the Harris County Department of Health. I assume. And do you contract with them? How are you affiliated?
I'm not officially. I am my own organization. I do my own thing. Now, I do serve actually on the advisory council for the Area Agency on Aging. But no, I'm my own separate organization. I do refer a lot to the Area Agency on Aging because they are the funder of a lot of different and really great programs. But I am 100% independent. Yeah. Yes, ma'am.
What about drug costs?
Sure. So for Harris County, we do have a prescription assistance program. I'm sorry. Yes. Please repeat the question about drug costs. Yes. So basically, you're asking about the cost, if we provide assistance, how to get assistance with the cost of prescriptions? Yeah, so we with the Harris County Area Agency on Aging can assist with the cost of prescriptions. It's essentially a one-time service. We do have a prescription assistance program. Now, none of our services are emergency services. So if you call us today to let us know that you only have like one more statin, unfortunately we can't provide you. It takes about a week or so. It takes some time to get everything up and going. But we do provide prescription assistance. It's a one-time service to help with the prescriptions that a person has. And then we also have a home meds program that basically reviews, where we have a pharmacist who reviews your medication to see if there's any drug-drug interactions. And once again, it's free of charge. All of our services pretty much are free of charge. The only thing is that they're not emergency services, and nor are they ongoing services. For example, the prescription assistance would be a one-time thing, and then we would refer you to somebody else. We'd give you a list of resources for further assistance with prescriptions. Like, for example, you'd asked about the cost of things, and we don't charge, but it's short-term services. So, for example, if you need prescription, one time. If you need dental assistance, it's one time. Eye care, vision, et cetera, all of that is one time. But that's, once again, on the AAA side, not so much the ADRC side.
100 hours of breast time or time only, or can that be renewed?
Well, on our side of the house, for the ADRC, one time only. And the AAA side, I can't remember how many hours of respite they provide. It all depends on the age of the consumer. And even like the emergency alert system, the life alert, I've fallen and I can't get up. That's a one-time thing, but we provide it for a year. So we provide the cost of subscription or whatever. We provide the ongoing cost for a year. And then after that year, if you still need the subscription, then you can get it at a discounted rate.
And so let's say you called me with that question about prescription drugs. Now, I don't have any funding that can help, but what I would do is of course refer you to their program for funding, but then we would also have a conversation. Tell me a little bit more about what's happening, because one of the things that I've learned over the years is that many times people treat their doctors as sacrosanct, right? What the doctor says goes. And we don't ask questions sometimes that we need to ask, such as telling your doctor, this is, I had to do this with my own doctor. My doctor gave me a prescription that was like $1,600 a month. And I said to her, I'm like, I can't afford that. What other options do I have? And a lot of people don't know that they can ask that question. And so part of our conversation would be for me to ask you, have you told your doctor that it's hard for you to afford this medication? Because sometimes doctors have samples that they can do so that you're not having to fill it as frequently. Sometimes they can put you on a slightly different drug that costs, like in my case, instead of the $1,600 drug, it was still expensive, but it was a $400 drug, which was something, I could at least afford some. And then my conversation with you would be, have you contacted the manufacturer? Because a lot of manufacturers have programs that will reduce the cost of your medicine if you can't afford it. And then we would talk about, does your pharmacy have a program or a generic? So I wouldn't necessarily be able to say, here's some money to pay for it, but here are some other avenues that we can talk about that may be able to help you. Yes, ma'am.
I don't know if you can tell people, but my Canada drugstore has very inexpensive drugs. For instance, if you're on a $450 drug a month, which I contacted Canada and I was able to get 3 months for less than the cost of 1 month. So it's legitimate. You can actually get it through the mail. You can go online. You can scan your you have to have the prescription. You scan it, you give it to them. It's my Canada drugstore, and they will send it to you, and it gets here really quick, and it's a lot less expensive.
Well, I can't. I don't know. Like I don't know.
I'm not sure if you're allowed to say that. But I tell the doctor. The doctors will go along with you.
I do know though one program that's here in the States. Mark Cuban, who's it used to be, I guess he just sold it. The owner of the Mavericks started a low-cost prescription drug company, and he did it honestly because someone sent him the idea and said, "What do you think about this?" He's like, "Why not do this?" And so it is certain types of medication. It is by mail only, and I believe you have to set it up through the internet, which can be a barrier to some people. But it's another option that we would talk about in terms of, is this something that could work for you? And so that's what I do, right? It's yes, there are programs that are great and important, but also what other types of questions or resources can we look at to kind of figure out how to address that issue. One of the things with the Area Agency on Aging and the ADRC, like if you actually look at the list of services, like it goes even far beyond what Carmen has said. And so one of the challenges, out in the community is that people don't necessarily know what they don't know, right? You don't know that they have that transportation service. You don't know that they have a program that can help get people insured. You don't know, because who would have thought to ask? That's part of where I come in, but that's also the numbers that she gave. Call them and say, what do you have for me? Here's my situation. What services do you have? Or I can work with you to get that information as well. And so that's why, we both come at, we could both come from different angles to the same thing, but that's why they're so complementary, because sometimes it's easier to go direct. Sometimes it's better to have the conversation, depending on your need, depending on your situation, and where you're at. What other questions do you have for us?
Carmen, do you make public address, like visit community centers, city clubs, whatever?
Absolutely, yes, definitely. We can go out and make presentations with regard to services by the ADRC or services by the AAA. Yes, we are more than happy to go. We have an outreach team. As long as it's in Harris County, we will go anywhere. And you can reach me by calling that 832-393-4301 number, but my direct line is 832-393-4513.
For those of you at Prince of Peace, y'all are coming on February the 8th to our meeting for the teenagers.
Oh, wonderful. Okay, as someone from the City of Houston Health Department, or?
Actually, you were on the
Oh, okay. Okay. I get copied on a lot of emails, so as long as... Oh, yes. Okay, wonderful. She actually came and spoke yesterday at the, and she talked about AAA services. And so if I keep trying to divide between AAA and ADRC, it's because yesterday Rose talked about the AAA. So good. Yeah, Rose has over nearly 30 years of experience with the AAA. So you have got a great speaker coming.
We can do presentations on, I have like a list of topics that I've done things on the past, or also if you are part of a group and you say, we would love to have someone come talk about, something what you feel is kind of random. Call me anyways, because either A, I may have it, or I could tell you who to call to get that speaker. My job is about connection. That is my bread and butter. I want to connect people to the services. I want to connect people to each other. I want to do my part to make sure people stay connected to society at large. Yes, ma'am.
You seem to have a great startup going on there. How is it funded?
That's a great question. How am I funded? Right now, I am not funded. Right now, I'm really grateful that I have a husband with a high-paying job that allows me to do this, though that is coming to an end. So ultimately, I will be filing for my nonprofit paperwork so that I can be grant funded. But the thing is, at least for me, the work is too important for me to wait for a bunch of paperwork. So I've been doing the work anyways. Yeah, volunteering for myself, basically. Thank you. So yes, it would be really, really nice if I could figure out how to get paid for this work. But my goal is for the services to be free for the people who need them.
Tammy, I appreciate all the work that you've done. I mean, you've done so much, and you bring a wealth of information and a wealth of knowledge. So through your work with, before you went to U of H downtown?
Care for Elders.
Care for Elders, yeah. So Tammy brings with her a wealth of experience. Between the two of us, we probably have like a combined maybe 50 years of experience of knowledge and working in this ever-evolving, ever-changing world of aging. So, yeah.
So one thing, and I don't know if any of you remember, there used to be like a resource guide you could get at Walgreens. It was called the Senior Guidance Directory. So I was actually the last editor of that book, which is why I know so many different organizations. Unfortunately, that book is now out of print, though maybe one day if I get the funding, I can bring it back. That's why I know so many people in so many places, and what good is information if we don't share it?
Maybe you need to ask Mark Cuban to fund that.
That's a thought. That is a thought.
Once I get that nonprofit status.
Any other questions for us?
One of my projects I'm working on that's not directly connected to this is looking at where the biggest gaps of services are in our community, and then working with agencies to start addressing them. So I'm kind of like, and if you ever find yourself needing data on older adults in our community, like that's one of the things I work with as well. So
you might tell them that they had a complete sheet for all the people here.
Oh, you already gave that one.
You know, the Office of Aging, the Catholic Conference here, the states, and it has all these agencies, and you guys are on here.
Oh, great. I did not know that.
And they have your phone number, your email, your name, and what organization you're with.
Okay, so apparently that was in your packet.
You want to see what it can describe it to them, but, I mean, it does give this information.
Okay. So for those of you who may be listening to this recording sometime after the fact, the Office of Aging for the Archdiocese has a resource sheet of everybody here at the conference for the vendors, and so it's got contact information for all of us, apparently, who either speaking or have tables here today. And I know we're set to go until 12. So one of the things we can do, because sometimes people have questions and don't want to ask them in front of everybody else, we are happy to stick around. And if you would like to come talk with us about your particular situation or a situation of a friend or of your loved one, whatever your situation may be, please come talk to us. We're happy to start directing you and getting you connected. Thank you for sharing your Saturday with us.
Thank you. Very good.
Thank you.